Welcome and thanks for joining us for this edition of Scope. Effective and safe COVID-19 vaccines have been approved for emergency use since the end of 2020, and countries are actively vaccinating their people. Nevertheless, hesitancy towards the vaccines exists not only in Papua New Guinea but globally. Issue 15 of a Spotlight edition research conducted by the PNG National Research Institute revealed poor vaccination awareness, inadequate vaccination centers, shortages of vaccines, and misinformation on social media, making people reluctant to take the vaccine.
COVID-19 has resulted in the loss of lives of many people and has affected the economy of most countries. Vaccine to protect people against COVID-19 has been developed. However, the reluctance of people to receive safe and recommended available vaccines, known as vaccine hesitancy, was already a growing concern before the COVID-19 pandemic. Associate Professor Eugene Ezebilo, Deputy Director for Research at the PNG National Research Institute, conducted a study on the impact of COVID-19 pandemic on the livelihood of households and their coping strategies. The research is based on interviews with 813 residents of Goroka, Kokopo, Ley, and Mount Hagen. In the report, emphasis is placed on whether the residents have been vaccinated against COVID-19 and why some of them have not been vaccinated, and a strategy to increase vaccination rates.
Most of the respondents, they know about COVID. They are really aware about COVID. But the problem is that some of them don't really know where the vaccination centers are. Another striking thing is that most don't even know the age group that should be vaccinated. You know that there's age group, especially in terms of from 18 years and above. But most don't know. Some of them believe that it's everyone, and some believe that it is only those people who has the virus that should be vaccinated. So with that now, we decided also to ask them whether they are vaccinated or not. We find out that most are not vaccinated. Only few, for example, I will read from here. For example, on average of the 813 respondents, only 12.7% have been vaccinated. Ley had the highest vaccination rate, which is 18.1%, and Kokopo had the lowest, which is 8.5%. So you can see that based on the 813, that a lot of people have not been vaccinated.
The vaccines include AstraZeneca, Pfizer, Johnson & Johnson, Sinopharm, and Moderna. The 3 COVID-19 vaccines that have been approved for use in PNG, according to the McGill COVID-19 Vaccine Tracker Team 2021. Ezebilo highlighted 7 main reasons for vaccine hesitancy in the communities the study was conducted. Firstly, the inadequate awareness about COVID-19 vaccines, because major concerns raised by several residents include proper awareness about how the vaccine works, its side effects, the group that should get the vaccine, and what can be done to reduce the side effects, have not been conducted. Some raised the concern that awareness has not been conducted in the areas where they live. Second, misinformation on social media. With the wide availability of smartphones, more people can now access the internet and social media without much trouble. Although this can be a great tool for self-education, which is a key component of vaccination decision-making, it also presents several challenges in the form of misinformation, including anti-vax messaging and incomplete information, as well as inconsistent and complicated scientific information that may be difficult to understand. The religious belief that COVID-19 vaccine is linked to the mark of the devil. As majority of Papua New Guineans are Christians, some religious sentiments have found their way into the discussion on COVID-19 vaccine. Major concerns raised by the residents include that the religious leaders have asked them not to take the vaccine because it is associated with evil. The first week of October saw several anti-vaccine protests staged in Port Moresby, Lae, and Mount Hagen. In Port Moresby on Monday, 1st October, a crowd of people, majority being adult and young men, a number of children and a few women, gathered at the Unagi Oval to march to Parliament in protest over the COVID-19 vaccines and the no jab, no job policy that has seen many people lose their jobs over.
Vaccine, to be honest, like, me no got plenty idea, like, all idea me got logan and based lo, like, data present lo, lo internet, all stuff, Google. When me read him logan chole, me got idea lo but me knows, like, fully aware of what's going on and like vaccine and one pepes and like, me know fully aware. Because nowadays, now when all vaccine to man, vaccine, I'm like, I'm confusing it because also vaccine, but still also COVID yet, still all die yet, what kind of so normal man. So, like right now, I'm also me plus talo confused state. Like, even though me stalo medical school too, me no fully sure awesome. Like, vaccine, I'm 100% guarantee, look, keep you safe for COVID-19.
My job requires me to get vaccinated, but in the first place, I thought it was not good. So, we had some, outside sources, information and all this stuff. So those type of information made us scared, me and some of my colleagues. And then my two male colleagues went and got vaccinated. And then when I saw them, like, they didn't get any side effect or this type of things. So, and then I made up my mind just recently, maybe a month ago.
Recently, a 2-day awareness program for the Southern Regional Church leaders on COVID-19 vaccines was held at Saroa Village, Rigo District in Central Province, facilitated by the PNG Council of Churches. The dialogue for COVID-19 awareness included 30 representatives from the mainline churches of the Southern region. The purpose of this dialogue was raising awareness on COVID-19 vaccines to ensure that church leaders are sensitized on information regarding the vaccine, resourced with updated information that they obtain correct and evidence-based information, and help reduce the severity and mortality of COVID-19 and reduce pressure on the healthcare system in PNG. Dr. Desi Mekonnen, EPA Technical Officer with the World Health Organization, gave a presentation that included updates on the global scale of COVID-19 statistics and vaccination rates. The church leaders asked many questions that Dr. Mekonnen answered to provide clarity about many misconceptions held by the majority of people, causing vaccine hesitancy.
The current available vaccines in Papua New Guinea, we have AstraZeneca, J&J, and also Sinopharm. So these vaccines are effective and safe vaccines. So the effectiveness is about like 70%, for instance, for AstraZeneca. So which means that still people might be vaccinated, but there is still few people may be also infected. But the good thing is those vaccinated people, they will have only very mild symptoms, like very mild, and some of them are actually asymptomatic. There is no any symptom, and they didn't know whether they were infected. So which means that vaccines are effective, almost 99%, in terms of reducing severe illness, hospitalization, and deaths. So this is the most important that people should understand.
The people of Papua New Guinea share a collective responsibility in fighting this pandemic. Therefore, continued research on COVID-19 vaccine acceptance and hesitancy should be a priority. Such research should then be used to inform campaigns and information sharing that will ultimately result in increased confidence in the uptake of available vaccines.
When we come back, Special Parliamentary Committee anticipates a second hearing on gender-based violence and to hear how relevant stakeholders have implemented recommendations of how to address GBV and related issues. The Special Parliamentary Committee for Gender-Based Violence held a press conference addressing a strong message to the government that come the next budget session on 16th November, proper funding be allocated to implement the national GBV strategy and resourcing of GBV activities across the country. The committee is also anticipating the second hearing to get an update on how relevant agencies and stakeholders have implemented the recommendations of how to alleviate GBV and related issues, recommendations that were made as a result of the first hearing.
Chairman of the Special Parliamentary Committee for Gender-Based Violence, Charles Abel, with fellow committee member and Governor for NCD Powers Pakop, represented the committee. They raised concerns relating to the rise in GBV cases and how the COVID-19 pandemic throughout the country has contributed to the increase of violence in homes and societies. A public investment program submission for 37 million kina over a 5-year investment program that was made by the Department of Community Development and Religion to be used to set up the National GBV Secretariat in order to ensure that GBV crisis response and prevention activities are implemented throughout the country. The Royal PNG Constabulary also made a substantial budget bid to support their family sexual violence units, and it's evident from the public hearing in May that the prosecution service and courts require better resourcing in addressing GBV cases. Minister Abel said that the committee is here to continue to remind the government that it is very important as part of this process to activate the GBV Secretariat in the Department of Community Affairs.
To continue to support the prosecution process with the police department and the Office of the Public Prosecutor and other elements of the process like counseling or safe houses or supporting the provincial-based initiatives. Funding is always a critical element. It's very hard to get these things moving if the necessary financial resources are not allocated.
Abel said that one of the primary intentions of the conference is to remind the government of those commitments, and they look forward to the tabling of the budget and the Treasury Department capturing those elements as committed to by the Treasurer on the floor of Parliament when their report was tabled. The committee has also been advocating for the special temporary measures around reserved seats for women in Parliament.
It's a controversial topic, and there is no perfect solution to this issue. But we feel strongly, especially after the comments made by the Prime Minister, that something needs to be done, even if it's an interim measure, to make it easier for women leaders to come to the floor of Parliament, where today there are no representation from women in the floor of Parliament, despite the fact that women make up slightly more than 50% of the population.
Governor Pakop mentioned that of the committee's priority list of recommendations they hope the government will action includes the question of where the legislation for reserved seats for women is, that has been heard and talked about all year. With the elections forthcoming in less than a year, Pakop stressed that there was still nothing concrete shown to reserve a minimum number of seats for women in the national parliament.
We have the national general election, writs will be issued in April next year. What are the chances of women being elected into parliament? Going by 2017, the chances are not really good. And especially as this time, the economy is slowed down, capacity of everyone, political parties and candidates to contest is low. So given the dynamics of women having access to finance and having access to resources, they will be in a much worse position than the men or political parties or current MPs. So what are their real chances of winning a seat? And this is why this temporary special measures is most important, is to guarantee that at least some women will be in parliament.
Governor Pakop said that there is still time and that the Boundaries Commission should take action. Rather than recommending 22 new open seats, they should use their powers to promote reserved seats for women. The Special Parliamentary Committee members also announced the second public hearing for the 29th of November to the 1st of December this year. This will allow the committee to speak with government and relevant agents on what they have done since the first hearing and to understand the progress that has been made to implement the 71 concrete recommendations tabled in Parliament. GBV is a virus that eats away at the foundations of a home. People need to change their attitudes and refrain from using violence as a means to resolve matters. The committee members have stressed how they made strong recommendations on how to alleviate GBV and related issues, and all these are captured in the 71 recommendations that were tabled in Parliament. We must break this cycle of violence, and this appeal goes to all of humanity to create peace in your communities and homes as the next generation is watching and learning from all you do.
After the break, inaugural ICT Summit hailed a success as government charts a clear direction of the anticipated National ICT Policy 2021. The first ever summit on information, communication and technology was held over a course of 3 days. ICT stakeholders engaged in a series of sessions to share experiences, challenges and ideas with the government so that it can understand and establish current trends and development in Papua New Guinea and to be able to chart a clear direction in information on the anticipated National ICT Policy 2022. The summit was held under the theme Enhancing Our Economy Through ICT and Digital Transformation.
Proper use of information and communication technology and digital technologies can enhance operational efficiencies across all sectors of the economy and improve social development and accelerate economic growth. To leapfrog towards the digital economy, Papua New Guinea needs proper coordination of resources to intervene in priority areas where it can make the most positive impact. The government policy focus since 2008 to date is on a sustainable competition that will bring about a market discipline to drive accessibility and affordability. Today, the trends and practices in the sector have changed. ICT is now driving transformation across all sectors of the economy. This needs to be supported by relevant and appropriate policies and legal framework. The inaugural ICT Summit was underway at the APEC House between the 10th and 12th of November. It brought together the public and private sector to share experiences, ideas, and discuss current trends, practices, and developments in the use of ICT and digital technologies towards charting a pathway for better collaboration and partnership.
The summit is part of the government's initiative through my ministry to engage with you, to engage with all of you, our key stakeholders, and to understand and establish current trends and developments in Papua New Guinea so that we are able to chart clearer direction to inform the anticipated National ICT Policy 2022.
Keynote speaker and Prime Minister James Marape said not only have they endorsed the digital transformation policy, but government has sought to escalate ICT to a strategic level by endorsing the drafting instructions for the Digital Government Bill.
The Digital Government Bill 2021 represents what will be a major wave of public service reform as it provides a whole of government approach to ICT in public service and ICT as a major platform to ensure our public service is reformed and unified. The bill will formally establish a national cybersecurity, as the minister has advised, and a center will be established to protect and ensure that all our digital infrastructures, informations and assets are maintained, are secured and are safe. And none can be more reminding than the evident that our IFMS system was breached.
Through a series of hosted presentations and panel discussion delivered by policymakers and industry experts, participants were able to deepen their understanding of the vision, strategy, and application of digital society transformation and innovation. Until recently, ICT has become a very useful tool in promoting and facilitating trade and commerce across the world through online ads, sales auction, banking, payment of utility bills, and so forth. ICTs have become increasingly popular and useful to governments to make available information in an organized and integrated way for the benefit of the people. Broadband connectivity is a prerequisite for digital transformation and for the growth of digital economy. In PNG, connectivity is still a major challenge. While major cities and town centers have some level of connectivity coverage, most parts of the country, including the rural and remote parts, remain unconnected. For some parts of the country that have connectivity presence, reliability is still an issue. Digicel PNG CEO Colin Stone was among some of the first speakers at the summit, sharing Digicel's experience in providing telecommunication and related services to the masses, including those who are unreachable.
Where have we come from and where are we going is always the question. But to address where we're going, it's important to look at and assess where we are now. Much has been discussed in the last 12 to 24 months regarding off-island bandwidth of national networks that still today mainly connect just the beaches. But admittedly, not much has been shouted about in regards to the rural connectivity and connecting not only the cities but those on the edge. Those who in the past, any service delivery has been marginal at best. 3 years ago, the board of Digicel and the Digicel PNG management team approved a plan to bring digital services like those available here in the cities to the rest of the nation, and we started. Like any plan, it's had its ups and downs. The impacts of COVID were felt and the economic factors made things a little bit harder, but we continued with the plan and I'm pleased to say the team continued the acceleration despite those impacts. When we look at the themes of what we're asked as a panel to discuss today, I'm proud to say that across Digicel PNG, we have gone to great lengths to support the government's strategy to deliver services to as many people in Papua New Guinea as possible.
Mr. Stone went on to speak about the reliability of ICT services, saying, without reliability, accessibility and affordability becomes irrelevant.
In just the last 3 years, we as Digicel across the nation have had a capital investment program that has bought new batteries, new generators, new solar panels to over 750 sites across the nation. And the team plan to complete all of the Digicel sites across Papua New Guinea within the next 24 months. This was our commitment to reliability.
However, upgrading towers, which then send signals to handsets, is only one part of the puzzle, Mr. Stone said. The other part is the inputs to the network, including power connectivity. He said power impact affects people's ability to access digital services. The government was keen on hearing every key stakeholder's views about the theme, enhancing the economy through ICT and digital transformation. Some questions that the government wanted answered included, what are the policy alignments? What are the strategies of driving costs down? What are the requirements to build sustainability models in the sector? Where should governments stop and businesses take over? And what are the opportunities for investments that our stakeholders can participate in?
That ends another episode of Scope, a kind reminder to apply simple measures to prevent the transmission of the coronavirus. Regularly wash your hands with soap and water, cough or sneeze into your elbow, and exercise social distancing. If you are feeling sick, please stay at home. You can also call the COVID-19 hotline number for more information or assistance. Thanks for your company. See you in our next episode of Scope.